For a number of years, I worked in offices in very close proximity to chain smokers. A few years later, I found myself working in a non-smoking office. May of 1991, the night of my last working day for this employer, found me in the emergency room with severe pains in my left side, urinating blood. I had kidney cancer, a kind of cancer that is primarily found in smokers. I am not a smoker. The entire summer was spent in and out of Valley Med with tests, getting poked and prodded like a pincushion, with eventual removal of the kidney in July of that year. This surgery required no chemo. I finally found a part-time job that fall while pursuing my goal of being a full-time voice teacher. Everything was going well until January of the next year when I developed what I thought was a urinary tract infection. It turned out to be bladder cancer. An errant cancer cell had lodged in my bladder. A few months later, I was back in Valley Med to have the tumor scraped out. The chemo for this was not as bad as for other cancer patients. It was not intravenous, nor did I lose my hair. However, it was not a romp in the park either. Weeks of chemo over several years kept me awake after each treatment, making me feel like a zombie. Rather than file bankruptcy, I continued to make monthly payments to Valley Med and still owe a significant amount of money for those 2 hospitalizations and surgeries. During all this time, the only medical insurance I had was 3 years while teaching as a sabbatical replacement at a local university. When that job ended, I did have COBRA, but that was very expensive and eventually ended. Now, as a primarily self-employed music teacher, I am uninsurable. I cannot get an insurance company to quote an exorbitantly expensive premium, let alone get insurance. I even joined the National Association of Self-Employed because they said they had group health insurance. Surely I could get into this. It's group health insurance after all. Well, I was turned down. After paying their monthly dues, I couldn't get access to one of their most important benefits. Needless to say, I resigned from the organization. I have been uninsured ever since. My daughter has been insured with a major HMO nearly all her life. However, even she has had trouble trying to get the help she needed for her acne. They kept referring her to a primary care physician who never helped her, instead of to a dermatologist, as we had numerously requested. I finally had to pay out of pocket to an outside dermatologist for her to get any help. When you are self-insured, you pay out of pocket a lot for your own doctor's appointments. Walking in the door will cost you a minimum of $100. If you need something else, any testing whatsoever, that's a lot more money. I'm not talking specialist, I am talking family practitioner. God forbid you should need a specialist. Unless you have had cancer, you can never know the stresses in the mind of a cancer patient or a survivor. Even when you are told you are cleared, you always live in fear of every ache and pain you develop. The late Congressman Paul Tsongas made it through the 5-year mark, only to have succumbed to his stomach cancer a year or 2 later. The ability for those of us without medical insurance to pay into a government-run health insurance program, like an expanded Medicare program, would put our minds at ease, to say the least.